Okay, this exercise is called knee extensions. So you'll have them sit on the machine like this with their foot behind this part. And then they just lift their leg up like this, nice and controlled for 3 sets of 15. All right, this is the hip IR and ER with the sports cord. So you can do it in a running position, going like this, and then going the other way when you rotate the other direction. This is hip ER because the hip's opening up. This is hip IR because the hip's rotating in. And you can also have the patient do it behind them like this, so 2 directions, ER and IR. This is what it would look like the other way. You can have them do it like this or like this. Okay, this exercise is called hip airplanes, and it's similar to an RDL. The patient will just be standing on the affected leg, bringing their other leg up behind them, and keeping it straight and balancing like this.
So you're gonna have it hip hiked, you're gonna hinge forward, and you're gonna have them drop, open up the hip, and drop the hip, kind of doing a rotation side to side.
Okay, this exercise is called TKEs, or total knee extensions. So they'll put the sports cord around the affected knee, just right behind, and then they stand kind of with their legs in a split stance with the affected leg behind, and then they just straighten the knee like this so that it's extended all the way. And then the other way that we can have them do it is on a step. So they'll come over here, they'll step up with the affected knee, and then go into total extension like that, and come back down. To make it more difficult, you would add the band around the knee as well. All right, this exercise is called the Bulgarian split squat. So usually we have the patient put one foot on a table like this, a table or a chair, and then they're standing on the affected leg. They're just going down into a squat. We don't want their knee to come over their toes, so if they need to, they can kind of adjust just to make sure that they're getting into a nice good squat like this. All right, this exercise is called retro walking. You'll turn the treadmill on a very low speed, and the patient is just going to walk backwards while the treadmill is going. Make sure the patient is holding on, because even though it's going slow, we still don't want them to accidentally slip and fall. Okay. All right, this exercise is called prone hip extension. So you have the patient lay on their stomach. They can kind of be on their elbows a little bit, but not too much. And then they're just going to lift their leg up and down like this. All right, this exercise is called Sidelying Hip Abduction and Adduction. So you'll have the patient laying on their side like this, and they're just going to bring their leg out to the side like this. You want to make sure they're not doing toe up, and they're not coming forward at all, just up to the side like this. And then for adduction, you're going to have the patient bringing the other leg up like this. All right, this exercise is called RDLs. So what you'll have the patient do is have weights in their hands. They can do one hand or 2 hands. Usually we have them with weight in both hands. They'll be standing on one leg and kind of bending over. The movement is in the hips, so you don't want the back to bend or the knees to bend at all, just kind of bending at the hip like this, going down, and then back up on one leg. All right, so these exercises are the hip isometrics. You can do 4 directions. So there's flexion, where they're pushing against their hands like this, then extension, going down, and then they can bring their legs together like this and push their legs out. A lot of times we'll have them use a bolster in between their legs like this to do the one where they're squeezing in. And then for abduction, you can put one of these straps around their legs for them to pull out. All right, this exercise is called ball bridge with a hamstring curl. So the most common way that you'll see the patients do it is they'll bring it in like this, bring their legs up, and then slowly come out. So this would be eccentric. Then they'll go back down and bring it in, come up and go out. The other more advanced way is that they'll keep it up and just go out and then back in, which is just a little bit harder. All right, so this is the universal machine, and the patients can do a few different exercises on it. So one of them is just normal squats. They just go back and forth like this, and the weight that they're using will be written on their chart, so just make sure that they're doing the right weight. And then there's also iso squats, which can be done in a few different positions. Normally you'll have the knees at about 45 degrees, just holding it for 10 seconds 10 times. They can do it a little bit straighter or a little more bent, just depending on what the PT wants them to do. All right, this exercise is the step up and over. So we've already learned this. This exercise is important that they're stepping up with one leg and then down with the other. And up with one, down with the other, just so that the affected leg is getting the full workout. All right, this exercise is called single leg running motion, and we can do it with the band or the sports cord. So just have the patient pretend they're running, just bringing their leg up like they're going to run back and forth like this. They can also do it without the band if needed. All right, in the Orem office, there's a machine called the Stair Climber. It doesn't get used very often, but make sure you know how to use it just in case a patient needs it.
This is a contract, relax stretch. So you're gonna have the patient lie down on their back if you're doing the hamstring. But this stretch can be used in any muscle that we're working on. So I'm gonna have her straighten out this leg, and I'm gonna take this leg up and go to a point where she feels a stretch. Do you feel a stretch right now? And to out there. And she's gonna contract her muscles, so she's gonna try to resist against me. And this is why it's a partner exercise, is because you have to be able to help them resist. You hold that for about 10 seconds and then have them relax. And they'll go a little bit further. I'm gonna use my body weight so I can help out. And then contract again. And then relax. And you can typically get the patient to go a little bit further in their stretching. When they're contracting, you want them to hold it for about 5 seconds, imagining that they're driving their heel towards the table. And then once they're done contracting, you'll tell them to relax, and you'll stretch them even further. Wow, I don't know English. Okay. Contract, relax, stretch. No, I just need to not talk and do it at the same time.
Yeah.
I can't look at you, mind. I have to focus.
Okay, go for it.
So their hip is hiked up. You're gonna have them hinge forward, and you're gonna with the back leg kind of up in a hip hinge position. You're gonna have the hip hinge. What?